Hello, my name is Silvia maulida, and now I will give a little explanation about coronavirus or COVID-19. Coronavirus or the SARS-CoV respiratory syndrome, coronavirus 2 or SARS-CoV-2 is a virus that attacks the respiratory system. This disease caused by a viral infection is called COVID-19. Coronavirus can cause mild disturbance to the respiratory system, severe lung infection to death. Severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, better known as the coronavirus, is a new type of coronavirus that is transmission to humans. This virus can affect anyone, such as the elderly, adults, children, and infants, including pregnant women and nursing mothers. Coronavirus infection is called COVID-19 or coronavirus disease 2019 and was first discovered in the city of Wuhan, China at the end of December 2019. This virus is transmitted very quickly and has spread to almost all countries, including Indonesia, in just a few months. This makes some countries implement policies to impose lockdowns in order to prevent the spread of coronavirus. In Indonesia, a large-scale social restriction (PSBB) policy was put into place to suppress the spread of this virus. Coronavirus is a collection of viruses that can infect the respiratory system. In many cases, this virus only causes mild respiratory infection, such as flu. However, this virus can also cause severe respiratory infection, such as lung infections. In addition to the SARS-CoV-2 virus, there are coronavirus viruses that are also included in this group are the viruses that cause severe acute respiratory syndrome, or SARS, and the virus that causes Middle East respiratory syndrome, or MERS, although caused by viruses from the same group, namely coronavirus. COVID-19 has some difference with SARS and MERS, including in terms of the speed of spread and severity of symptoms. Symptoms of coronavirus or COVID-19. Early symptoms of coronavirus infection or COVID-19 can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headache. After that, the symptoms can disappear and health or even advance. Patients with severe symptoms can experience high fever, cough with phlegm, and even bleeding, shortness of breath, and chest pain. These symptoms appear when the body reacts against the coronavirus. In general, three general symptoms that can indicate that someone is infected with the coronavirus, namely fever or body temperature above 38 degrees Celsius. 2. Dry cough. 3. Hard to breathe. There are several other symptoms that can also appear in coronavirus infections, although more rarely, namely diarrhea, headache, conjunctivitis, loss of ability to taste or smell, rashes on the skin. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient is exposed to the coronavirus. Immediately to independent isolation if you experience symptoms of coronavirus infection or COVID-19. As mentioned above, especially if in the last 2 weeks you're in area that has case of COVID-19 or contact with sufferers of COVID-19. After that, contact the COVID-19 hotline at 119 or 9 to get further directions. If you might be exposed to the coronavirus but don't experience any symptoms, you don't need to go to the hospital. Just stay at home for 14 days and limit contact with others. If symptoms appear, then do isolation independently and ask your doctor by telephone or application about what action you need to take and what medication you need to take. Coronavirus infection or COVID-19 is caused by a coronavirus, a group of viruses that infect the respiratory system. In most cases, coronavirus only cause mild to moderate respiratory infections, such as flu. However, this virus can also cause severe respiratory infections, such as pneumonia, Middle East Respiratory Syndrome, or MERS, and severe acute respiratory syndrome, or SARS. It is suspected that the coronavirus was initially transmitted from animal to human. However, it was later discovered that the coronavirus was also transmission from human to human. A person can get COVID-19 through a variety of ways, namely accidentally inhaling saliva splashes or droplets that come out when people with COVID-19 cough or sneeze, hold the mouth or nose without washing hands for after touching an object affected by saliva splashes of a COVID-19 sufferer. Coronavirus can infect anyone, but the effect will be more dangerous or even fatal if it occurs in elderly people, pregnant women, people who have certain diseases, smokers, or people whose immune system are weak. For example, in cancer sufferers. Because it is easily transmitted, the coronavirus is also at high risk of infecting medical staff treating patients with COVID-19. 3. Medical personnel and people who have contact with COVID-19 patients need to use personal protective equipment or PPE. Coronavirus diagnosis or COVID-19 to determine whether the patient is infected with the coronavirus. The doctor will ask about the symptoms experienced by the patient and whether the patient has just traveled or lived in an area that has a case of coronavirus infection before symptoms appear. The doctor will also ask if the patient has any contact with someone who is suffering or is suspected of having COVID-19. To confirm the diagnosis of COVID-19, the doctor will carry out the following tests. Rapid tests to detect antibodies, IgM and IgG, produced by the body to fight the coronavirus. Swab test or PCR, polymerase chain reactions test to detect coronavirus in sputum. CT scan or chest X-ray to detect infiltrates of fluid in the lung. A positive COVID-19 rapid test is most likely to indicate that you have already been infected with the coronavirus, but it can also mean you're infected with a germ or another virus. Conversely, a negative COVID-19 rapid test result does not necessarily indicate that you are absolutely free of the coronavirus. coronavirus treatment or COVID-19. There is no effective drug to deal with coronavirus infection or COVID-19. Coronavirus treatment or COVID-19. There is no effective drug to deal with coronavirus infection or COVID-19. Treatment option will be tailored to the patient condition and severity. With mild or asymptomatic symptoms, will be advised to do a self-isolation protocol at home while continuing to take steps to prevent the spread of coronavirus infection. Complication of coronavirus or COVID-19. In severe cases, coronavirus infection can cause the following complications: pneumonia or lung infections, secondary infection in other organs, kidney failure, acute cardiac injury, acute respiratory distress syndrome, death. Coronavirus prevention or COVID-19. Until now, there is no vaccine to prevent coronavirus infection or COVID-19. Therefore, the best preventive way is to avoid the factors that can cause you to be infected with this virus, namely, apply physical distancing, which is to maintain a minimum distance of 1 meter from other people, and not to go outside the house unless there is an urgent need. Use a mask then on the move in public places or crowds, including when you go shopping for groceries. Wash your hands regularly with soap and water or hand sanitizer, especially after doing activities outside the home or in public place. Do not touch the eyes, mouth, and nose before washing hands. Increase endurance with a healthy lifestyle, such as eating nutritious foods, exercising regularly, getting enough rest, and preventing stress. Avoid contact with people with COVID-19, people who are suspected of being positively infected by the coronavirus, or people who have a fever, cough, or runny nose. Cover your mouth and nose with a tissue when you cough or sneeze, then throw the tissue in the trash. Keep clean objects that area often touch, and environmental cleanliness, including cleaning the house. That was a little explanation about coronavirus. Thank you. See you next time.